Can diverticulitis perforation cause sepsis? Have you ever wondered if a perforation from diverticulitis could lead to sepsis? The answer is yes, perforation of diverticulitis can indeed cause sepsis. Diverticulitis occurs when small pouches, known as diverticula, in the colon wall become inflamed. In severe cases, these pouches can rupture or perforate. When this happens, bacteria and intestinal contents can leak into the abdominal cavity, leading to a serious infection that can spread throughout the body, resulting in sepsis. Perforation typically arises from intense inflammation and tissue death in the bowel wall. This damage compromises the integrity of the intestinal wall. Once a perforation occurs, bacteria can escape into the abdominal cavity, potentially causing localized infections or a more widespread condition known as peritonitis, which is an infection of the abdominal lining. If the infection spreads into the bloodstream, it can trigger sepsis, which is characterized by systemic inflammation and can lead to organ dysfunction or septic shock, a critical condition that requires immediate medical attention. Clinical evidence indicates that patients suffering from perforated diverticulitis often show signs of severe infection. This includes abnormal vital signs and elevated levels of inflammatory markers, such as C-reactive protein. Imaging techniques, especially computed tomography scans with contrast, are vital for identifying perforation and any associated complications like abscesses or free air in the abdomen. Timely diagnosis is crucial because untreated perforation can lead to severe complications, including high rates of morbidity and mortality. Management of this condition usually involves administering broad-spectrum antibiotics to combat the infection. Often, urgent surgical intervention is necessary to repair the perforation and remove any infected tissue. Surgical options may involve resection of the affected segment of the bowel, and in some cases, a temporary or permanent colostomy may be required, depending on the severity of the situation and the patient's overall condition. Early surgical treatment, combined with antibiotics, greatly enhances recovery chances and reduces the risk of death from sepsis. In summary, diverticulitis perforation is a serious complication that can directly lead to sepsis due to the contamination of the abdominal cavity and bloodstream with bacteria. Early recognition through imaging and aggressive medical and surgical management are essential to prevent the progression to severe sepsis or septic shock, ultimately improving patient survival. Understanding these risks and the importance of prompt treatment aligns with established medical guidelines for managing complicated diverticulitis. Always consult a healthcare professional for personalized advice and treatment options.